Hi everybody, I'm Vanessa Henderson, nurse practitioner with SSM Health, Healthy Living Clinic here in the Wellness Center. Normally I do a couple of talks a month, and today I get the honor to introduce you guys to Dr. Haynes. He is a fellowship trained orthopedic surgeon with SSM Health Bone and Joint OSOI, which is a premier orthopedic practice with 6 convenient locations throughout central Oklahoma. He earned his medical degree from the University of Oklahoma before completing his residency and internship at Barnes Jewish Hospital in Washington University, St. Louis. He also completed a prestigious fellowship at the Anderson Orthopedic Research Institute near Washington, D.C. Dr. Haynes focuses daily on getting patients back to doing what they love through hip and knee reconstruction and replacements, including robotic-assisted and minimally invasive solutions, as well as non-surgical treatments. Today, Dr. Haynes will be talking with us about how we can keep our bones and joints healthy and moving while we stay at home during the pandemic. He'll be sharing a few words, and after that, answering some questions live. So feel free to type them in, your comments as you think of them.
All right, well, very good. Well, thanks, Vanessa, for that introduction. I'm Jacob Haynes. I'm a hip and knee reconstruction surgeon, and today we're going to talk about keeping your joints and just overall being healthy and active while we're kind of at home or not doing our normal activities. And so as we're live streaming, if questions come up at a specific point, feel free to shoot those in and we'll kind of try and address them as we go. So thanks for tuning in if you're tuning in now or watching this later. So currently, right now, obviously, with the pandemic and social changes, most people are having a bit of a more sedentary lifestyle than they normally would. You're not getting out and being as active as you normally would, and this has some negative impact on not only your joints but other aspects of your body. Your cardiovascular system, your pulmonary system, muscles, and then joints are also affected. And typically, as we are a little bit more sedentary, people have a few more aches and pains. I've definitely noticed in my clinic over the past couple months, patients that do come in are having more joint stiffness, more joint pain, maybe joints that weren't causing them a lot of problems before are giving them some more issues now. So today I have some pretty simple, straightforward, practical tips to try and help minimize, joint pain and promote staying active during the current social situation. A number of people have taken up different home exercises and things like that, but overall, as we are a bit more sedentary, joints, especially if there's any aspect of arthritis or kind of predisposition to them getting stiff or painful, do have a tendency to develop that even more. So it's not necessarily a sign of structural damage, it's just those joints do get a little more irritated and bothered, and that's because they're not being utilized kind of in the normal way. And so I'm going to go over about 8 points that I have here. Again, they're pretty straightforward, pretty simple, but just things that are very practical that can be done to kind of help minimize this. And it also helps with the cardiovascular system, the pulmonary system, and things like that as well to promote a healthy, active lifestyle and keep pain and joint stiffness at bay a little bit here. So number one, stretching. Stretching a few minutes every day can be very beneficial. And so that can be in the morning before you go to bed. Usually it's the most helpful if you basically kind of have the same time every day. And there are plenty of resources to kind of help with kind of general whole body stretching. And so if you have access to the internet, there are some very simple YouTube videos. If you look up whole body stretching routines, these can range from 3 to 5 minutes all the way up to 25 or 30 minutes. And they walk you through it step by step. So that's just a very good way to kind of get yourself either up and going, up and moving, or before you go to bed, same thing, kind of a nice cool down for the day. And just does help keep those muscles as well as those joints limber, lubricated, and that does kind of keep that stiffness and pain a bit at bay. And so that's a very easy, very low impact way to do it. And I recommend that for patients, whether you've had a joint replacement in the past or whether you have still your own hip or knee or shoulder, whatever joint is giving you issues. Point number 2, I think it's important for folks to get outside every day if that's practically feasible for you. That doesn't necessarily have to be getting out and going to another location, but getting outside is very beneficial because number one, it gets you up and moving. You're leaving your dwelling and going outside. There again are cardiopulmonary benefits from getting up, walking around, those kind of things. And then it's good for mental health as well. You get out of your house, you kind of get out of, kind of feeling confined, and get out and enjoy, the weather. We're having some pretty unseasonably cool weather here in Oklahoma, and so getting out in the morning when it's cool, there's not as many people outside, and it's also, better. And so you can come up with a task every day, go out and weed your flower bed, or, do different things. Every day, if you can try and get outside, that does go a long way to both kind of helping with the mental aspect of having a more confined lifestyle, and again, for the joints and everything else that we're focusing on today. The next couple of points get to exercise a little bit, but one of the most simple exercises that requires no equipment at all is walking. And that's something that can be done either inside, or kind of getting into the outside part if you have access to a sidewalk, a walking trail, even your backyard or something of that nature. Walking is a very good way to get exercise, and it's a very easily tracked way. So you can, try and set goals for yourself. Try to walk more, today than you did yesterday, and that can be up and down your hall if you're totally stuck inside, or that can be around the block. That can be to the mailbox and back. I had a patient the other day who, she's basically tried to add one trip to her mailbox and back every day over the past 4 weeks, and now she walks back and forth like 35 times for mailbox. But whatever you do, that kind of goes back to getting outside and keeping active. And that's a relatively low impact exercise for your joints as well. We'll come across some of that in a minute, but the lower impact exercises are typically more joint friendly, especially if the joint is a little bit more prone to getting stiff or irritated. As we are, point number 4, as we are more sedentary, we're doing a lot more things like sitting around and reading, or watching TV, or on our computer more, or just inside. And so making a point once every hour to get up and move. And that can just be, get up and take your book to a different chair and read, or get up and go get a drink from the kitchen, or do things like that. And I think one practical way is if you have a watch or a smart watch or just a timer, set the timer for 55 minutes and get up 55 minutes after you've been sitting there and change locations. And that does a couple of things. That keeps you from being as sedentary. That also gets you up and moving. And so you see a theme here, we're focusing on getting you moving and things of that nature. And so getting up every hour and doing a little bit of activity, can be very helpful. And if you're going to go back to a sedentary activity, that gets you up, gets the blood flow, gets those joints from moving. If you sit still for multiple hours at a time, that's when the joints really like to stiffen up and stuff. That's why in the morning when people get out of bed, those joints can be pretty stiff. So during the day, getting up and moving at least once an hour is a very reasonable thing to do. Another way to do that, if you're watching a TV show and there's commercials on, every time there's a commercial on, get up and walk out up and down your hall or things of that nature. So that can be pretty helpful as well. We kind of touched on it with point number 3, but low impact exercises are typically the most well tolerated with a joint that's stiff or painful. And this can take a couple different forms. Walking is a very easy and accessible way to do that. There are other things as well. If you have access to a pool or some body of water, water walking, doing some kind of water type exercise can be very beneficial. Cycling is a very low impact exercise, and that can take a couple forms. That can be stationary inside if you have access to a bike or a gym, or it can be outside. I mean, that's an activity where if you're within 6 feet of somebody on a bike, then you're probably in trouble. That's a good way to have a low impact exercise. Good for the joints, also really good for your cardiovascular system as well. There's also activities like yoga, and this kind of goes back to the stretching, but some yoga exercises or low impact kind of cardio exercises, and there are a lot of resources online for that. There's a number of, again, YouTube type videos that I know Fitness Blender is one that comes up a lot if you just search low impact whole body exercises. And these are, routines that can range from 20 to 45 minutes that you can, pull up on your phone or your computer and do in the confines of your living room or a very small space. That's a good way to stay active there that has a lower chance of irritating the joints or things of that nature as well. If you are inside a whole lot, kind of going back to the point of getting up, focus on cleaning a different room each day, doing something where you're getting up, kind of, cleaning one room a day, whether that's vacuuming, dusting the shelves, those kind of things. They get you up and get you moving. You're reaching up high to dust, you're squatting down to clean baseboards, you're doing those things. You also get a bit of a sense of accomplishment from accomplishing a task kind of every day, and that goes back to a large part that I see with people getting their joints stiff, just kind of feeling cooped up, not as active, is there is kind of a mental component of feeling I'm not quite as productive as I normally am. So if you have some tasks each day that you address and get done, that's good for the mind and the body as well. And then the last point, what are some of the medical things that can be done to kind of help with joint pain? And typically the best class of medications that people can take over-the-counter wise are anti-inflammatories. So that's things like Aleve or ibuprofen, naproxen. Those are very common over-the-counter anti-inflammatories, and those are the most effective class because when your joints get stiff and inflamed, an anti-inflammatory is typically the most helpful medication for that. There are some patients that can't take oral anti-inflammatories, whether they are on blood thinners for cardiac reasons, if they have kidney problems, if you've had a history of ulcers, things like that. So if there's a reason that one of your other physicians has told you not to take them, certainly don't start those kind of medications unless you consult with that physician, but that's typically the most effective class of medications. There are topical forms of those over-the-counter topical anti-inflammatories as well as prescription strength ones. And those are nice for those patient populations because those don't typically interact systemically. They're a medication you apply on your skin. That medication kind of absorbs to the joint that's affected. Also, some kind of natural stuff, glucosamine and chondroitin are two over-the-counter supplements, often like osteobiflex or things like that, that can promote joint health. They have some mild anti-inflammatory properties. I tell my patients with stiff joints, kind of treat it like an athlete. So if you're going to get up and go outside and go walk or go work in the yard, warm up a bit beforehand, whether that's some stretching. Some people actually have a warm pack they'll put on that joint, kind of loosen things up a bit before they get going. And then when you're done, cool down. So either a little stretching when you're done, an ice pack, a cold pack, a pack of frozen peas, something of that nature to kind of help things cool down. And that can be very beneficial as well to kind of minimize that joint swelling and getting bothered. And then compression and elevation can help if you're a little bit more prone to swelling. And so sometimes people will have things like a little pull-on knee brace. You get them over the counter at Walgreens or Walmart or wherever. I don't particularly recommend the ones that have big metal supports on the side. Those can kind of inhibit the motion of the knee, but just like a little neoprene one that provides a little compression can help with some of the swelling or stiffness. A little ace wrap on the knee can be very helpful. Sometimes people wear like TED hose or things like that if they're prone to kind of more generalized swelling. And those are just ways that will, if you swell up, things then become stiff. So this is a way to kind of get in front of that. And then when you are done, elevating, getting that, particularly the leg, getting that, propped up on some pillows if you are putting an ice pack on it, that can help decrease that swelling or minimize it as much. And so those are just some practical ways to kind of minimize swelling if your joints are a bit more prone to that. That's kind of mainly, those are some of the practical points I have. And then if you're having symptoms such as this pain has gotten bad enough and some of these things that you tried aren't giving you the relief you want, that's certainly a time to potentially seek out orthopedic care. And things can be done in clinic, including x-rays to see what exactly is going on in terms of, is there a lot of arthritis? What is the status of the cartilage in the knee? Those kind of things. Treatments that can be done in clinic that can't be done at home, or potentially formal physical therapy, doing things like different injection options into the knee. That's another way that you can deliver a stronger medication to the joint that's giving you issues. And then discussing other different treatment options there. And so our clinic is practicing safe ways to see patients and stuff like that. And so if there are questions, concerns you want to get in to see an orthopedic member of our group, feel free to do so. Our number is 218-2530, and my extension is 5137 if you particularly want to give our office a call. And so that's kind of what I have in terms of the talking points here. Maybe some questions have come in, or we can kind of take things as they come.
Let's see. Larry says, good morning. I just had shoulder surgery and his comments are very helpful. We're asking him if he has any questions.
Perfect. Thanks, Larry.
I think most of these you've already covered. So, are there specific times when I should or should not wear a mask when exercising? Do you have that?
Gotcha. If the audio feed didn't pick it up, the question was, are there specific times you should or shouldn't wear a mask when exercising? And so, obviously, with if you're going to a location such as the gym here or another health fitness facility, they're often following guidelines, and so I would adhere to whatever the recommendations of that building are. If you're outside and you're more than 6 feet away from somebody, in my opinion, I think it's safe to have your mask off, but everybody's got to do what's preferable for them. Certainly you want to take care of yourself and those around you. And so, I kind of defer to personal preference, but you definitely want to be safe in whatever you're doing and feel comfortable with what you're doing. So.
Is there a specific, having terrible knee pain and maybe being evaluated for that, doing mobility, exercise, anti-inflammatories, kind of at what point do you guide patients that perhaps maybe it's time to consider surgery as an option?
Sure, yeah. So when I'm talking to somebody about surgery, specifically my specialty is joint replacement, the indications for doing surgery on a joint, when it's painful, are basically the joint is quite painful. It's keeping patients from doing things that they want to do. You don't need to be crippled in a wheelchair, but it's basically making it where you're having a difficult time, doing activities you want to do. The things you have to do are tough. Your world kind of shrinks a little bit, so you're making decisions around that hip or that knee pain. Your imaging, so things like x-rays or whatever imaging studies we have, do show that you have, arthritic change. You've lost that cartilage, that normal joint surface. You've had symptoms for quite some time. If somebody's coming to me with 1 or 2 weeks of pain, we're definitely trying the non-surgery stuff first. It's when it becomes more chronic and you've tried a large number of these non-surgery things, exercises, medications, whether it's by mouth or on the skin or injections, and you get to the point where that's just not giving you the quality of life or relief you're looking for, then that's when, the option of surgery comes into play, and we talk about what's involved with a hip or a knee replacement, what are the different options there, and kind of take things from there. So that's when I kind of advise my patients to consider and think about when surgery would be helpful.
Okay. Larry McWilliams is asking, he's recently had the shoulder surgery.
Mm-hmm.
He's having the most problems sleeping.
Mm-hmm.
He doesn't seem to be able to get comfortable, and he's run out of his higher dose pain meds, and the NSAIDs aren't enough. Is there a certain technique of sleeping or anything that you tell patients?
Nighttime can be one of the rougher times after surgery. Shoulders particularly can be pretty bothersome at night. Oftentimes I don't do a lot of shoulder surgery. I have a couple partners that do more shoulder surgery. I kind of focus a little bit more on hip and knee. But oftentimes sleeping upright in a chair, sometimes with some pillows around the shoulder, those kind of things to give that shoulder support can be a little bit more helpful. A lot of times after shoulder surgery, early on, especially in the weeks after surgery, laying in a recumbent position is a little bit more difficult. That shoulder kind of wants to roll to the side. In terms of the different medication options, there are medications that aren't quite a high-powered narcotic, but are a little bit stronger than anti-inflammatories. Sometimes things like tramadol can be helpful. That may be something to talk to your physician about. They have kind of a protocol to step down off the really high-dose pain medications. And then sometimes too, if the pain is more muscular, you're having more spasms or things of that nature, some mild muscle relaxers or things can also help kind of relax the shoulder girdle muscles and allow for a little better sleep. But that's very normal early on after a joint surgery, whether it's hip, knee, shoulder, ankle. Is early on. Nighttime is one of the times where people feel very restless or have a hard time getting comfortable, and that will pass and improve for sure.
Okay, awesome. What kind of exercises do you recommend for your hip or knee replacement patients in particular after they've had a replacement? Is there
Sure.
something specific?
In general, so my kind of blanket statement is patients can return to whatever activities they want to do. There's not really any good significant, peer-reviewed data in the joint replacement world that shows that higher impact activities wear a hip or a knee replacement out any quicker than none. Typically, when a patient is to the point that they're getting some type of surgery, they've cut out a lot of the higher impact things. So, probably not running as much or doing downhill skiing or things of that nature. So, lower impact activities in general are more well tolerated. But I tell my folks, get back to whatever you want to do. So I certainly have patients that hike, bike, run. I have a guy that likes to skydive. So when he lands on his joints, that's pretty hard on him. Skiers, things of that nature. And so you can do whatever you want. Kind of my rule of thumb is do whatever you like doing that doesn't bother your joint, that you will do. I mean, it's not very beneficial to do one exercise every 2 weeks. If you prefer to do something else, you would do it 3 or 4 times a week. So find something you enjoy doing, and that's safe to do as long as it's tolerable for you. And And so lower impact exercises are typically more well tolerated in an joint pain / arthritis / joint replacement population. Whatever activities you want to do are just fine. There are, especially if you're a little bit more stuck at home or want some guidance, the American Academy of Orthopedic Surgeons, AAOS, has a number of PDFs online and it's for all different aspects. So there's shoulder, there's back, there's hip, there's knee, there's ankle. And so if you search on your internet browser there, AAOS knee rehabilitation handout or back rehabilitation handout, there's a nice PDF that basically has some illustrations and kind of advises you on some different exercises specific to whatever part of the body is giving you some issues. And so that's a good resource that people are able to access at home for free. That is very easy to do and quite effective as well.
Okay, so a couple more questions. Is there a specific exercise that you should stay away from pre-surgery? Let's see, where you've had a joint replacement and knee replacement on another joint. So like if you've had a left hip replaced, is there a specific exercise that you're trying to stay away from to keep from needing to replace it?
No, there's not. That's a great question. No, there's no, in terms of exercise or activity, there's not an exercise that's going to structurally damage or worsen the arthritis in another joint or make it where then you have to have another joint replaced. You may find activities or exercises that keep that joint irritated or exacerbated. So certainly if there are those things that you come across, whether that's a certain activity outside, whether it's walking on uneven ground, whether it's if I walk more than 2 miles it bothers me, but a mile or less is fine. If something keeps it irritated, try and avoid that. But there's not an activity short of having a trauma where you have a big fall and injure the joint. Just doing exercise or activity does not predispose you to having joint replacement or make that joint more structurally damaged. So I would say no need to avoid specific activities for fear of causing damage to a joint, but certainly if it keeps that joint irritated or bothered, try and find a different way to get your exercise.
Okay, another one, what about over-the-counter stimulators or TENS units? Are they helpful for joint pain post-replacement or pre-replacement? And are they any better than the professional PT units? I would assume they mean the ones that PT
does or things like that. Some of the TENS stuff, I'll be honest, I'm not super well versed on every single level of TENS units. So there's a number of pain management physicians who will use TENS units. There's some that are actually have implantable leads. Physical therapists will use TENS units. There's over-the-counter ones that you can get. There's been some good data that shows that TENS units and other types of electrical stimulation can be helpful for joint pain. A lot of times it can be a little bit more helpful for the muscle pain around a joint. The actual joint pain from arthritis specifically comes from the fact that you've lost the normal joint covering. So you've taken a joint that normally has cartilage, which is the nice smooth joint covering, and so when you have a joint that's got a lot of cartilage in it, like a hip, which is a ball and socket, when you have that cartilage in there, that joint moves and glides and doesn't catch and doesn't hurt. When you have arthritis, you've worn off that covering. So now it's like a rusty joint, or you've got potholes in the surface, or whatever analogy you want to use. So that catches, that grinds, that hurts. That pain itself doesn't typically respond to electrical stimulation. However, the muscles around the hip or the knee, they've been compensating because people have been limping because their joint hurts. They get a little bit atrophied because you're not using that leg as much, and they get kind of painful. And so TENS units can be helpful for that. I can't tell you, personally whether the over-the-counter ones are as effective as therapy or other ones. Typically, in broad senses, when you're looking at medications or different things like that, things that are done or applied by professionals are often a little bit more effective than over-the-counter ones, but it certainly doesn't hurt to try an over-the-counter one, especially as long as you follow the guidelines in terms of length of use and all that kind of stuff.
Awesome. Let's see, Twila wants to know, are there any newer procedures for bunion surgery?
That is a great question, and I would defer to one of my foot and ankle partners on that one. Sorry, that could be more helpful on that one.
Let's see. You kind of mentioned like the stationary bikes and everything in small spaces and homes. Is there anything else that you, for instance, like weight bearing for joint preservation, that they can do at home, something like that?
Yeah, I mean, I think, things that fit into relatively small space. A stationary bike is a good one. Rowing machine is one that works well too. That obviously takes up a little bit more space, but that's one that gets the whole body involved. It's low impact. You're not smacking those joints back and forth. Ellipticals are lower impact than treadmills because your foot is fixed. You're not bringing it up and going back and forth. There's obviously restrictions on, you can have one of those machines in the middle of your living room. And then online resources. And so there really is a huge amount of videos on, YouTube's the most common platform, and you can search low impact exercises, and they're made to be done in very small spaces without weights or things like that. There are plenty of exercises that use resistance bands that are available online or in a store that can add a little bit of resistance, and you can use those for a lot of different activities. And so those are all ways to really get kind of a whole body workout in a very small space that's low impact. And I imagine too, obviously in the past few months, there's been a huge uptick in people working out at home or not having access to their normal gym facilities. And so I would imagine, compared to 4 or 5 months ago, I'm sure there are on orders of magnitude more videos and online support specifically for different things. And so, a lot of the videos, like I said, Fitness Blender is one that I've known in the past, and they have a ton of videos. Some are very high impact, cardio workouts. Some are very low impact. Some are stretching. Some are yoga. And so those are kind of videos that walk through these kind of things. And again, you can use equipment or not. And so whatever video you end up finding, give it a try and stuff. And I think those are good ways to stay active and stuff in a low space, in a small space.
We often talk, and several times even have done talks here about the importance of exercise on the waistline.
Yeah.
But and of course, preservation of joints and like you touched on, treatment of joint pain. Do you have anything more to kind of speak on about like maybe weight reduction helping that?
Yeah, absolutely. So weight reduction is very important with joints for a few reasons. The mechanics of things, the less weight is on a joint, definitely the less irritated that joint can become. It's a little bit questionable whether or not, having extra weight on it, propagates wearing out faster, things like that. I certainly think there's a component of that. The knee, especially the kneecap joint, the patellofemoral joint, the way the mechanics on that work is if your knee is bent more than about 45 to 50 degrees and you're getting up, so stepping up a step, getting out of a chair, those kind of very common everyday activities, that joint sees about 6 times your body weight. So something as simple as a 10-pound weight loss actually takes about 60 pounds of pressure off of that joint with those very common activities. So weight reduction for joints is extremely helpful to make them less symptomatic, less painful, potentially wear out a little bit slower. And then should it come to the point where you're thinking about surgical interventions or things like that, having a healthy body weight makes surgery, certainly safer, less chance of things happening around the time of surgery and complications and things of that nature. So I think that's a very important aspect. All right.
I don't have any further questions. We don't see anything else right now.
All righty. Well, very good. Well, thank you guys. And if there's anything, any questions or things like that, we are still doing, some virtual visits and things of that nature. So you can always give our clinic a call, 218-2530, extension 5137. We're here to help you out. So thanks so much.